Welcome back. To complete our discussion on the medical home, joining me again, Dr. Daniel Duffy, the Dean of the University of Oklahoma School of Community Medicine. Let's jump in. Now, the medical home is a fascinating, patient-centered medical home. It's a fascinating improvement, I think, in terms of coordination of care. Talk to me a little bit about proactive types of care because, you know, in the medical or health model, we do try to focus on issues of prevention versus waiting until something gets really bad. We kind of understand that. But what's this proactive concept with the medical home?
Well, in the past several years, there's been a tendency as physicians have become busier and changes in the healthcare financing have occurred for for the relationship to be centered on visits that are based on a complaint. I have a problem, so I go to the doctor's office, and so the doctor's work is actually designed by the appointments on the schedule that patients have made because they have a need. But the patient-centered medical home turns that upside down, and although those services are still delivered, it agrees in a patient-centered medical home, the physician and the team agreed to manage the care for 2,000 patients and to proactively manage that care. That means they set up a plan of preventive maintenance scheduled on a regular sequence, notify the patient when it's time to have those done, and encourage the patient to come in and have their preventive care performed. Likewise, if a patient needs to see the doctor today rather than waiting for 3 weeks or 4 weeks for an appointment, we attempt to have open access where the patient can call and be seen within 24 hours of when they need to be seen. So with the combination of proactive planned care and ready access availability, the service provided by the patient-centered medical home is much more patient-centered and designed to meet the needs of the individual patient.
You know, and I can see where it could maybe even improve health more, which is what it's trying to do, because I don't have to remember whether it's time for a physical or not, because I'll get a reminder that it's time for the physical or it's time for these other things. Or if you're at a point where you need a colonoscopy, I don't have to remember, do I need one or I don't need one, or am I there yet or what? I'll get that information and notice to say it's time for this.
Exactly, and as the science changes and the recommendations change, those are built into the patient-centered medical home protocols rather than having to be taught to patients across the city about what to do. You can see now why the School of Community Medicine has based its educational programs and its clinical care on this principle of the patient-centered medical home.
Which is excellent. Now, tell me a little bit then about how this affects others. Let's say beyond, let's say the adult, which is what I've kind of been talking about, as it filters down into others within the home, whether you have children or let's say you're in that sandwich generation and you're caring for older parents or whatever it is. How does that apply? Because maybe where I think I'm going, can I really bring everybody along? Or if I can't, where do I go put them? I mean, how does this work?
And there are lots of choices in that area. So a number of the medical homes are becoming family-centered medical homes where the entire family are welcome. Usually it's specialists in family medicine who operate those medical homes, but it could be a medical home that's made up of a team of internists, pediatricians, and family physicians with their assistants, physician's assistants and nurse practitioners make up the team that would provide care to families. There are others, particularly in internal medicine, that provide cares to your sandwich families that you talked about. So everybody's an adult in the family, and they may not be living even in the same household, but they all get care from the same patient-centered medical home. There are advantages to that, obviously, in that the common social and genetic factors are now understood by one team. On the other hand, it may be that adults choose their own separate patient-centered medical homes, and that's perfectly okay as well.
Now, how would it be, because sometimes, especially young adults may feel like, well, if I'm going to a family-centered, they're going to tell my parents or they're going to tell somebody else what's happening to me. That confidentiality is maintained.
Nothing about me without me.
Yes.
And so that's the whole issue. The relationship is between the individual adult and the physician and the provider team, the physician team. So the other members of the team may know those things, but we're not permitted to share that information, and unless it's to the benefit of the individual patient involved.
Okay. Now tell me a little bit about, let's say if a person has to have surgery in that environment, how does this patient-centered, because you kind of think of, you go to the hospital, there's a whole nother surgeon, and you're kind of left to the mercy of another group of people, another team. How does this work if I'm a part of a patient-centered or family-centered medical home if I have to go then to a surgical or that kind of environment?
And that's the usual situation that occurs. So we've talked about that as the coordinating of care function of the patient-centered medical home. So the team actually develops the communication systems through telephone and internet and electronic transformation of information, so that what we call in healthcare now the handoff from the primary care site to the hospital or the surgery site becomes seamless. All the information goes about, about you goes with you when you go into the hospital. Now, it's increasingly unlikely for the primary care physicians to be visiting one of their medical home patients in the hospital, although some still do. But what we're doing now is coordinating that care so that the right hand, primary care office, and the left hand, the hospital surgical facility, know what each other are doing. We're all operating out of the same playbook. We all have different jobs and different roles, but we're operating on the same. And when we're done with the surgery, we return back to the primary care physician who can follow up. Now, what's very interesting is in the current healthcare law, there is going to be redesign of the payment structure so that it will really encourage these two separate groups to coordinate the care and work together. In fact, payment is going to be dependent upon how effective that coordination of care is.
Excellent. Well, in our last minute here, I want to ask you quickly about this concept of concierge.
Yeah, concierge medicine is a thing that has come about where some doctors have attempted to limit the size of their practice so that they can deliver much more personally focused care. And they do this by charging the patient a amount like $1,500 a year for that special service. So it's a kind of care that's really limited to only the most wealthy patients, and it does give them very personalized care. What we hope is that the patient-centered medical home will deliver very comparable care by having a team work together with more advanced health information technology so that everybody can benefit from those services that the concierge practice can deliver.
Okay, and once again, that becomes the underlying philosophy with the University of Oklahoma School of Community Medicine with the name change and how you facilitate that within your Schusterman Clinic.
Right on, absolutely.
Okay, thank you so much for joining me. And what was that saying again? Nothing with you without you?
Nothing about me without me.
Nothing about me without me. I like that one. Thank you so much, Dr. Duffy.
Thank you, Pam.
Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear comments, questions, or suggestions for future shows. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150, or if you're on the email trail, please email me at healthalertusa@gmail.com. And don't forget to visit me on youtube.com/healthalertusa. And don't forget to check out the patient-centered medical home, the resources that are available to you, and the competent care that's there. And remember, nothing about you without you. Take care. This program would not be possible without the support of OU Physicians in Tulsa.